Welcome back. We'll now go into our next committee, the afternoon committee meeting of the Lake Whatcom and Natural Resources Committee of the Bellingham City Council is chaired by Councilmember Dan Hamill.
Thank you. We have two items before us today. The first is relates to Whatcom County Pharmaceutical Stewardship Ordinance. Whatcom County is considering a pharmaceutical stewardship policy which would require the manufacturers of medicines sold in the county to finance and coordinate a comprehensive medicine take-back program for all county residents. Medicine take-back programs provide a secure and environmentally sound way to dispose of leftover or expired medicines and are part of a comprehensive approach to preventing prescription drug abuse and reducing pharmaceutical compounds entering the environment. Medicine producers will develop a stewardship plan, and the Whatcom County Health Department will review the plan and oversee the approved program for safety and compliance. And Ted Carlson is not here to take us through. It's Renee LaCroix, sorry.
Hi, Renee LaCroix, Public Works. In Ted's absence, I'll go through it. So the city has a pharmaceutical take-back program that's been in effect since 2010, and in the intervening years, we've diverted 15,000 pounds of pharmaceutical waste from the waste stream. We have 5 pharmacies that participate, and then the police department. And Whatcom County is looking at building on those efforts and expanding the program to a county-wide. And I brought Erica Nuremberg, who is the Assistant Director of the Whatcom County Health Department, to talk about what the county is proposing.
Great, thank you. Good afternoon. Again, my name is Erica Nuremberg. This is the first time I've been in front of you, and I'm the Assistant Director of the Health Department. Hello. That was a great short explanation of the program. I want to just very briefly ground you in some data and then very briefly ground you in some history before I talk a little bit more about the nuts and bolts of the program, what's coming next in terms of the legislation, and how the City of Bellingham and the Bellingham City Council specifically can help with this effort. So, as you all know, I'm sure you're quite aware, opioids is a national epidemic, and certainly we are not immune to it here in Whatcom County. Our needle exchange program continues to grow and grow and grow every week, and we see the effects of it everywhere. So nationally, last year, opioid overdoses became the leading cause of death for individuals under age 50. It surpassed car accidents, so it's a huge problem nationally. We also know that about 2 million people in the United States are addicted to opioids, and 3 out of 4 users of heroin started by using prescription drugs. So that's just a bit of grounding. Locally, we know that parents are concerned about kids having access to medications and using them either without a prescription or using them illegally or without knowledge. We survey parents and youth every year, and 78% of parents feel that youth have severe risk for harming themselves if they take prescription opioids without a prescription or without parents' consent or knowledge. So we are concerned about it locally, of course. So obviously there's a lot of strategies to address opioids. We are trying to look at this from a really holistic perspective and including lots of partners. We are thinking about the secure medicine return, which I'll explain just briefly, as part of kind of a continuum. So the first step is further education with providers and doctors about prescribing practices. You don't need to prescribe 30 pills if 5 or 10 will do. The second is, and I have a little show and tell, so we're also starting a campaign to have these lock bags in homes. We want to make sure that people take having opioids in their home seriously like they would a firearm, that there's risks associated with having them in your home, and if you're taking them, this has a combination and it also has a lock. And of course, I mean, anyone could break it open, but the idea is really to just have that awareness, right? And so then the third step is these drop boxes, and this is what one would look like. The secure pharmacy return, or the secure medicine return, is something that was paved the way by the DEA in 2014. They expanded their rules to allow not just law enforcement, but pharmacies and clinics or hospitals with pharmacies to be able to take not only uncontrolled drugs like over-the-counter drugs, but controlled substances including opioids. That has not really expanded a whole lot until counties started to require it, and especially require it of, as you mentioned in the brief overview, of pharmaceutical producers to pay for that service. So King County and Alameda County were the first two, and they were both sued. So we sat back and watched and made sure that we were not in that position. They both prevailed in courts. And since then, Snohomish County, Kitsap County, and Pierce County have all passed secure medicine return legislation. There is a bill currently sitting in the state legislature, and it has been for the last 3 sessions. It has not gone anywhere. And while it's not our preference to do this county by county, it's really inefficient. It's where we are at this point. So what the legislation would do would require that Med Project, which is a conglomeration of pharmaceutical producers, come up with an implementation plan to have drop boxes in any pharmacy or clinic hospital with a pharmacy that opts in. So it's voluntary for pharmacies to participate, but the collection and the disposal is all paid for by Med Project. So what we did specifically for Whatcom County, because we are a more rural county and our city seat is not as big as the city of Seattle or the city of Tacoma, we actually lowered the threshold to require that for every 20,000 people in a population within a city, and it really only applies to the city of Bellingham, that they find a drop box. So in the city of Bellingham, there will be at a very minimum 5 drop boxes that are paid for by Med Project and take controlled and uncontrolled substances. More rurally, we will also have the option for individuals to get mailers, so they, without any cost to them, they can get a mailer and mail up to, it's about this size, mail up to about 4 prescription bottles worth, and that will be taken care of in the same way. This is also a nice benefit for homebound and for some of our hospice facilities and long-term care facilities to be able to give family members, upon the passing of a family member, mailers so they can dispose of those pharmaceuticals. So that's kind of the gist of it. You know, I could sit up here for an hour and talk to you about opioids, and I'm going to try not to do that for lack of time, but that's kind of the gist of it. So next steps are the county council, acting as the health board, asked the health department to put together legislation that they could consider. They will introduce it November 21st of this year, so this is all coming up very soon, and expect to consider it and vote on it December 5th. We are trying to make this happen by the end of the year. That was their desire. So we're moving forward very quickly, and we're actually in the midst of public comment period. We sent the distribution list out far and wide, so we're getting a lot of comments back. And tomorrow night we have a public listening session at Civic Center in the Garden Conference Room, which is that first floor. And anyone who's interested in coming and learning more about it or asking questions or expressing concerns can be there from 5 to 6:30 tomorrow night. So lastly, this is moving forward. The health board has indicated their strong support for secure medicine return, but there will be an implementation process, and there will also be a robust education and promotion campaign so we can make sure that residents understand what benefits are available to them. And we would love your partnership and help in making sure that your constituents know what these benefits are, and that we start getting more and more pharmaceuticals out of the home and out of kids' hands. So with that, I've just given you a lot of information. I'm happy to answer any questions you have.
Great, thank you. Committee members.
I just want to thank you for your work. This is very important, not only nationwide, but right here in Bellingham and Whatcom County. So thank you very much.
Thank you.
Yeah, I think this is a great effort. Definitely to support it. I just have one question.
Sure.
I have to ask about your bag thing. Has that been tried on older fingers, that combination? Because
there's a lock too, so there's 2 options. Yeah.
Okay, because I've seen how small that is, and knowing a lot of users are older, arthritis, diabetes, and other things make those things really tough.
That's good to consider, though. Thank you.
Yeah.
Okay, Councilman.
But I support the thing.
Right. Councilmember Murphy.
I uniquely appreciate this. One of the problems in our tribal community is that elders' homes are broken into and their pharmaceuticals are stolen. And this is a horrible thing that happens. And I would imagine it happens in parts of our Bellingham community also. We've taken measures like this. We're trying to protect our elders like that. But I would love to work with you to help you understand at least where our tribe goes to get their pharmaceuticals, because I'd love to become a lobbying effort to help those pharmacies get drop boxes if we implement this.
Actually, that's a really good point. We're working with both Lummi and Nooksack because we have a mutual aid agreement in place, and this could be sort of enveloped in that. So we're working with them to allow them to participate in this program without having to pass something individually. So that's in the works as well, which would be great.
Thank you. I'll support that in any way. Thank you.
I'll make one comment briefly. So I co-chair the Behavioral Health Subcommittee of the Incarceration Prevention and Reduction Task Force, and we are coming. That bag was presented, and this concept was presented at that committee. But we are also coming at it from the other end, which is the treatment end, which is very frustrating. Whatcom County continues to remain in the top 5 for opiate and heroin hospitalization treatment. So I think that this is a great program and definitely will support it.
Thank you.
Okay. And then, thank you. And moving on to our next item. This is a report out from the October 16th Lake Whatcom policy group meeting. Since I was at the Behavioral Health Subcommittee, I asked Councilmember Knudsen to record comments and report out this afternoon.
Thank you, Dan. This is one time I took notes, so I'll be brief. I had a charge to do, and I did it. We touched on 5 items. The first was stormwater, then land use and aquatic invasive species, proposals for flood control district fund and TMDL implementation plan. We reviewed the 2017 homeowner incentive program known as HIP. There was some confusion from some of the people in the audience. They thought it contained a basin 3. It's just basins 1 and 2. We had a regulation update on vacation rentals in the watershed. We had an annual program review of the aquatic species program, and I'll give you some good numbers. Our revenue was up 6% to $139,000. We inspected 12,000 boats, 6,407 permits. We also trained 11 people, and they went to Lake Mead, Nevada, where there's a horrible infestation of all sorts of zebra mussels and everything else. And we found this year no new aquatic invasive species found on boats at all. We also did a shoreline survey. We had 728 boats. We had a 76% compliance rate, 14% unknown, and 10% no permit. Also, we're going to get a grant of $54,313 from the Washington Department of Fish and Wildlife, which will help the program a lot, and another $6,750 to the AIS program for exit inspections and outreach. So that was a good report on that. We also talked about the flood control district briefly. The county's working on that. The 10-year TMDL implementation plan update will be coming to both bodies soon. I think it'll be at our next joint meeting. And then we discuss next year's potential meeting dates. End of report.
Great.
Michael.
This may not be for you, Gene, but did the county take action on their flood control zones?
Not as of that meeting, I don't think.
Okay. Thank you.
Barry, did they? Not yet. Thank you, sir.
Thank you, Council President.
End of my report.
Okay, great. Council members, any comments? All right, end of committee.